Welcome everyone. This is our discussion on the 300-hour yoga teacher training, which we call our professional yoga teacher training, because we are developing yoga teachers into professionals. I'm also here today to answer the questions about the difference between a Yoga Alliance program and an International Association of Yoga Therapists program. Let's start with the 300-hour yoga therapy training. This is really your on-ramp to become a yoga professional. And one of the things a yoga professional does is provide individualized, private, one-to-one yoga therapy with students and clients. This is about, I would say, 60% of the way that I spend my week is in private practice with clients. And I set up my practice so that there is a scheduling app. There is also an easeful way for them to pay for their appointments inside the scheduling app. I get to schedule out in advance when I'm available, so I'm not at the whim of the students' availability. They schedule with me much the same way that I would schedule to see a medical doctor or a therapist. I also have a home base for my yoga practice with clients at my yoga studio. And one of the things about having a home base is that you are in a neutral location. If it's a yoga studio, you're in a location that has a yoga vibe or a yoga feel, but you also get to be in one place for the afternoon. So you're not driving around town providing individualized yoga lessons. And I find that to be much more restful for me, that I'm in this one place for the day or for the afternoon, and I also have all the yoga props that I need available to me for whatever the client might be coming in to address. In our yoga therapy training, we also help teachers become professionals who can provide holistic, integrated, accessible, adaptable yoga for a wide variety of clients. We really want yoga professionals to be available to what's happening in the health industry. And by this I mean physical health, mental health, and spiritual health. We want you to be able to be a referral source for medical doctors, mental health providers, physical therapists, orthopedic surgeons, and so on. We also want to help you develop your special focus yoga therapy workshops, series, and trainings. Examples of this might include yoga for chronic pain, yoga for anxiety or depression, yoga for pelvic floor health, or yoga for recovery. So these are just a few ideas of yoga series that you can teach. We also used to use a yoga therapy clinic model, wherein people would come for the first time to a yoga therapy clinic on a specific topic, and then they would join a yoga therapy series about the same topic. So if a clinic had 20 students participating, and we had a series that was limited to 10 of those people participating, often we would get full registration for the series, and occasionally we'd have a waiting list for the next series. So let's ask the next question about how is a 300-hour Yoga Alliance training related to an 800-hour International Association of Yoga Therapists training. Also, how are the organizations related? Who is eligible to participate? Do the organizations oversee each other? And how long does the training take? Who is eligible? For our 300-hour program, we open it to all teachers who have completed a 200-hour Yoga Alliance training, even if the teacher has not registered with the Yoga Alliance. We recognize that not everybody wanted to register with the Yoga Alliance, but we do appreciate the dedication already displayed by having been through a training program. And there is something that you learn about being in yoga training by doing even the foundational training, a kind of learning about being in yoga school process that we also appreciate. In addition, we do strongly recommend that applicants have an established home practice, a minimum of 3 years of yoga practice, and part of that should be that you do practice at home. One reason to have a home practice, of course, for your own personal renewal and the personal intimacy that that is for you, but also when you set up private yoga therapy sessions for your clients, you'll be asking them to do a home practice based on the homework that you give them. You'll be providing them with suggestions, not just that they can take into their public yoga class, but they take it to their home yoga mat as well. Now, of course, attending public classes is also wonderful, and we recommend that you have both of these resources in your life for being a student of your home practice is different than being a student of a public weekly class. And since your students will likely be then experiencing both of those from your yoga therapy suggestions to them, we recommend you as well have both of these established. We do also recommend that before you attend our 300-hour teacher training program, you have taught for at least 1 year. You'll have a better experience in our training program. There'll be some questions answered already by having been in what we call the yoga teaching trenches. You've already learned a few things that you had to learn just by experiencing it. When you come to our 300-hour teacher training, we actively help you build on the skills from your first training so that you're coming into who you are meant to be as a teacher. And as I just said, the time you spend in the trenches of just teaching, that really can't be substituted with anything else. Even with continuing education or attending more classes or even internet training that you might have taken. It really has to be that you're vocalizing, verbalizing, languaging the yoga to your students. You're watching the students respond to your teaching. You're really engaged in some way in teaching a public class. Now the question often comes up, what about allied health professionals? So an allied health professional in a field that's compatible with yoga, like physical therapy or counseling or mental health, they are eligible to apply for our 300-hour professional training. Likely they are not planning on teaching a public class from this training. They are interested in integrating the tools of yoga into their existing work with patients or with clients. Now, something to consider for the certification with allied health professionals in these two organizations, if you are an allied health professional and you want to be certified with the Yoga Alliance at the 500-hour level, you do need to complete a 200 and a 300-hour training with a school registered with the Yoga Alliance. However, if you want to be certified by the 800-hour level IAYT program, and you're entering a 300-hour training from a licensed field, a qualified licensed field, you don't need a 200-hour certificate from the Yoga Alliance to do this. You do have to go on to complete our IAYT program for certification, but you can start at the 300-hour yoga therapy training level. This is confusing. So we've talked about this for so many years, and both YA and IAYT keep updating their standards as well. So let me explain that the IAYT does not include the 200-hour Yoga Alliance training hours as part of the 800-hour overall curriculum requirements. They recognize those hours as preparing a yoga teacher to become a yoga therapist. Just like you need a bachelor's degree before you go to your master's program, the IAYT recommends that yoga teachers have completed a 200-hour teacher training program. However, for the health professional, you don't need to have the 200-hour certificate if you're coming in with training in a licensed field that's compatible with yoga. So how are these organizations related? So Yoga Alliance accredits schools that provide trainings at the 200 and 300-hour levels, and then you become certified as a yoga teacher at the 500-hour level. The IAYT accredits schools that provide trainings that certify yoga therapists at the 800-hour level. And since yoga therapy is an advanced field of study, the IAYT does not include your 200 hours as part of that curriculum, but it's also because the customary experience of a 200-hour Yoga Alliance training is to teach in a public setting like a gym, athletic club, yoga studio, community center. And those public settings are group classes with drop-in students rather than a focused or specialized yoga therapy offering. So how are these organizations and our schools related? Our 300-hour Yoga Alliance training course is the first 300 hours of our 800-hour IAYT course. So the 300 hours becomes the 800 hours, and the question we often get is, but what happens when and how and next, and what do we do? So let's go through the curriculum, and then you can see where the 300-hour certificate comes in and what happens for the next level of your training. So part 1 of our 300-hour program is 160 hours, and we focus here on the physical, structural, and restorative medicines of yoga. So we have 4 modules of mindfulness-based yoga, adaptive yoga, yoga and strength conditioning, and Ayurvedic restorative yoga. Mindfulness-based yoga integrates the 5 kosha model, trauma-informed brain-sensitive understanding for really integrating that into yoga, methods and tools informed by brain science for restoring the brain and the body, interpersonal neurobiology, mindfulness of thoughts, emotions, and what we call in the Yoga Sutras the uncoloring of thought, and also mindfulness for healing attachment wounds. And the phrase attachment wounds refers to a concept in Western psychotherapy. It is not related to the philosophy of yoga discussing attachment and non-attachment. Our adaptive yoga module covers medically sensitive yoga. So for students with Parkinson's, with MS, with osteoporosis, students who have scleroderma or chronic pain, fibromyalgia or cancer, you'll learn how to teach yoga to students with hip replacements, knee replacements, shoulder replacements, and you'll learn about spinal cord injuries and much more than that. We have protocols for you to follow that correspond with the protocol for the orthopedic surgeon or for the physical therapist who sees the client after the hip replacement or after their mastectomy or after their knee replacement. So we give you the step-by-step process that you would recommend to your student that is in alignment with what their physical therapy team is recommending as well. The difference in that being a yoga protocol is we're also including the view that yoga is of life and of healing. It's a holistic undertaking. We're interweaving the mindfulness and relational interpersonal neurobiology into the sessions that you provide. And sometimes when people go to see their physical therapist, they're basically getting the mechanical experience of their rehab. As well, a yoga teacher may be working with someone who wants to regain or re-enter a yoga program. We want to teach them how to be safe and steady in the classroom as they heal from their joint replacements or other surgeries. Our yoga and strength conditioning module includes teachings on what we call the real core muscles of the body, which are not the six-pack abs. Also, it's for injury prevention and rehabilitation. We give you the pre-op and post-op surgical considerations for those joint replacements that I just spoke about, as well as for mastectomies and spinal cord injuries. In this module, we integrate physio balls, TheraBands, foam rollers, and balance boards. It's a totally fun undertaking for this particular module. And often the training students realize that they have their own strength deficits that they didn't even realize, or their compensations, or their patterns of exploiting one area of the body at the loss of another area of the body being involved. In our Ayurvedic restorative yoga module, we teach you the practices of restorative yoga based on Ayurveda. So based on the seasons of life, the season of the year, the time of day, and people's individual doshas. And here we integrate the 5 koshas and the 5 vayus with brain-specific meditations for really deep restoration at the whole system level. We also have recommendations for pranayama based on people's Ayurvedic doshas and the imbalances that they're coming in to the session with. Now, part 2 of our 300-hour yoga therapy training is 140 hours, and we focus here on the psychology of yoga and interpersonal neurobiology. This is a format of 8 weekends and 1 final immersion. This is a trauma-informed training. We really dive deep into the relational field of the teacher-student, therapist-client relationship. We integrate yoga psychology and dharma with interpersonal neurobiology and the tools of yoga along with the evidence-based Western psychotherapy methodology. In part 2 of our training, we welcome clinical psychologists, licensed social workers, mental health counselors, certified alcohol and drug counselors to join the training at this level if what they primarily want is the psychology of yoga, pranayama, meditation, and mindfulness to integrate into their practice with their clients. So part 2 of our 300-hour teacher training program often sees an expansion of the group from our base of 15 to 20 yoga therapists in training up to 20 to 25 people in the training program. And we have seen that the addition of these licensed mental health providers into the training really enriches the conversations that we're having about the integration between the East and the West. Yoga psychology includes the Yoga Sutras, the 6 stations of the mind, the koshas, the kleshas, the chakras, and the vayus, Kriya Yoga, Ayurveda, and the 4 paths of yoga from the Bhagavad Gita. In Western psychotherapy, we are looking at the evidence-based methods that come from the study of addiction and shame and protocols for recovery, as well based on my book, Hunger, Hope, and Healing, a yoga approach to recovering your relationship to your body and food. We also integrate polyvagal theory, developmental psychology, attachment theory, which relates back to a comment that I made earlier. This is not about the same attachment and non-attachment that yoga is discussing with us. And again, we use interpersonal neurobiology as a foundation here. At this point, when you've completed your 160 plus 140 hours, your 300-hour course is complete, and you become a registered, certified 500-hour level yoga teacher with the Yoga Alliance. And by the way, it's worth mentioning that in your 300-hour course, I'm there for all 300 hours. This is unusual in the yoga world, that the primary teacher and the person who developed the curriculum and the person who has been a yoga professional for 20 plus years is actually leading your training for 300 hours of the 300 hours of the training. So this is really full on, and we also bring in yoga therapists who have graduated and other qualified assistants to come into your training. At this point, the IAYT program begins. Okay, now, the IAYT will accept all 300 hours of our 300-hour yoga curriculum into our 800-hour IAYT program. The IAYT also allows us to accept students transferring from other 300-hour teacher training programs, but we have to use some discernment about how many of their 300-hour yoga training hours we are willing to transfer. And we do have a transfer credit policy, just like you would have at a university. We request that we can see the curriculum that you have already studied, if you've taken a different course than our 300-hour training course, because we want to see what parts might have been missing and what parts need to be developed. But once you are then transferred into our IAYT school, either from our 300-hour Yoga Alliance school or from a different one, the integrative yoga medicine courses begin. So yoga and orthopedics, the chakras and the developmental imperatives of human living, biofeedback, neurofeedback and yoga, yoga therapy and Ayurveda, the endocrine, digestive, and immune health related to yoga, bridging the conversations between the medical and mental health communities, yoga for cancer, internal family systems as a model for compassionate therapy. This is a system of therapy that I have studied, and its founder, Dick Schwartz, really developed a model for what I would call compassionate therapy. Yoga for chronic pain, attachment theory, implicit memory, and trauma-informed yoga, and finally the business of yoga, how to set up collaborations, referrals, and innovation, how to stay current with the field, and also how to run your business. What do you need on your business team? Even if some of those team members are contractors, what do you need to have a safe and sound business operation? So the IAYT will also require you to have 150 hours of mentored practicum. In our training school, this practicum begins after you complete Part 1 of your 300-hour Yoga Alliance training. And this practicum continues throughout the time that you're in the IAYT program. For some people, it continues beyond the program because they continue to have hours that they need for their mentorship. So a mentored practicum is understood as this. It includes structured guidance from me and our training faculty, while you are providing one-to-one yoga sessions for students, assisting and mentoring in our training sessions, assisting qualified yoga therapy programs such as assisting a teacher in a therapeutic series, and also providing your own small group yoga therapy experiences. So this is you putting your skills into action beginning from the completion of Part 1 of our 300-hour yoga therapy training. And you may not feel completely confident at that point, so we do provide you with mentorship to do that. If you're going to provide one-to-one yoga therapy, we give you an intake form, an assessment form, a way to self-assess the work that you're doing, and you have a library of photographs and protocols and ideas for offering to your student. If you're going to come assist one of our training sessions, you are supervised by myself and our other qualified graduate faculty. If you're going to assist a yoga series, for example, you come to assist that series with a qualified yoga therapist who is mentoring you by having you assist in his or her program. If you're going to provide small group yoga therapy, such as a low back yoga therapy series, we give you an intake form, an assessment process, and a pre- and post-evaluation form so that you're really following protocol that will then be accepted by the IAYT. Okay, how long does all of this take? Of course we ask this question because we're yoga teachers and we're busy, but we're also overwhelmed so often, and it can seem like it takes a long time for certain trainings to complete. I want to say that being in training is not just internalizing content, but really it's content as well as the integrative process that you are undergoing as you become a yoga therapist. So your own work will be occurring during the training. Your own transformation is underway from the first module. One reason that our program expands over a 14-month period of time is that we really see that developing into the yoga professional you're going to be does take time. So we meet once a month, and in between those sessions, you're able to go back to your classes or your clients and really apply what you are learning. So if part 1 is 4 midweek modules, and part 2 is 8 weekends plus 1 immersion, this takes 14 months to complete. For example, our next training begins October 28th and goes through about December 12th, 2020. Okay, the other important question is, what does it cost? And as I was saying before, you're making an investment in the training, but we're also making an investment in you. And as your lead teacher, I am present for every part of your training. You'll have the most expert guidance in this field, where I've been in private practice now for 20 years. In part 2 of your training, it's co-taught by Jay Gregory. He's a clinical psychologist, and he brings in his 20 plus years of professional experience to the training as well. You'll also be supported by our qualified assistants and mentors. So the investment in the training is actually less than $20 per classroom hour. So the cost is $5,500 for the entire 300-hour training program. We do provide payment plans, and we also have some scholarship options available. However, we strongly recommend that you set up your one-to-one yoga practice as you begin part 2 of your course. So here's an idea. If you begin part 2 of your training with doing these one-to-one yoga sessions, even though you're a novice, we're recommending that you set these up at a rate of $50 an hour. If you were to provide 4 sessions a week for the remaining 8 months of your training, it will cover 90% of the cost of your training and then some. So if your cost of training is $5,500 and you're exceeding that, you're covering at least 90% plus some of the costs of being in training, which means not being in your own classroom or not earning your own livelihood during the modules when you're in training with us. So considering all of that, 16 sessions a month at $50 a session will be a return of $6,400. Now after that, when you are certified, we recommend that you raise your rates. And you can put those up to between $70 and $85 a session while you're in your mentored practicum as it continues. Just as an example, my current rate is $120 an hour, and my medical scholarships are between $65 and $85 an hour. Now the IAYT program, how long does this take? This program is 12 focused modules, and the first cohort is going to begin in June of 2020. We anticipate that this is going to take 2 years to accomplish. Some of these modules are weekends, some are 3 days, some are 5 days. And this is based on the content and the amount of time, the numbers of hours committed to some of the modules. So we want to pace it out over the course of 2 years because we recognize by this time you are a yoga professional. You need to be in your private practice, in your public classes, in your workshops, and your series. So we want you to also be able to sustain your livelihood and then return for training modules at a pace that your life can navigate. So what is the investment for the 800-hour program? We set this at less than $1,250 per classroom hour at $6,200. This is for 350 hours of classroom training and 150 hours of mentored practicum. We do provide payment plans, and we will have scholarship options available. However, it's also likely that because this is a developing field, there may be qualified financial aid options because we're developing a professional field, much like other professional fields that then we're able to qualify for financial aid from educational institutions, from governmental institutions, and so on. You might then ask, what are your next steps? And the next step is really becoming a truly skilled yoga teacher and a yoga therapist. Apply for our 300-hour teacher training today. We only accept 20 students in our 300-hour yoga teacher training. We want the training size to be intimate but dynamic. We are totally committed to your success. So your next step is email us, call us, or set up a time for one of our discovery calls to talk more about your unique journey through our yoga therapy training. We look forward to hearing from you. Namaste.